If you ever feel out of control around food, you're not alone, and you're in the right place to learn practical, no-nonsense information about why you binge and how to stop. Binge eating does not mean that something is wrong with you. It's a natural but primitive brain response that you can correct. If you're ready for change, sign up for the Brain Over Binge self-paced online course for less than $20 per month. And if you feel you need personalized support, we also offer one-on-one coaching and group coaching. To learn more, go to brainoverbinge.com/subscribe. And I hope you enjoy the show. Welcome to the Brain Over Binge podcast, where you learn a simple, brain-based approach to ending binge eating. I'm Kathryn Hansen, your host, and I want to welcome you to today's show. My mission on this show is to provide useful insights and practical information to help you let go of binging and develop a peaceful relationship with food. It's Eating Disorders Awareness Week this week if you're listening at the time this episode is released. And while it's great to create awareness about eating disorders themselves, I think it's also helpful to recognize that everyone who has or has had an eating disorder does have a life outside of that eating disorder. So it can also be very helpful to create awareness about how eating disorders can impact those other areas of life, and to talk about what parts of life may present challenges that people should be aware of in order to stay on the path to recovery. One of my goals this year is to talk about this more, and a couple episodes ago I had a guest on the show to discuss how relationships can be impacted by eating disorders. And today I have a guest that will help bring awareness to an area that I don't see talked about too much in this space, and that's pregnancy, the postpartum period, and breastfeeding, which is a phase of life that can bring up various eating, body image, and emotional and physical challenges. I've received a lot of questions over the years about dealing with eating issues surrounding pregnancy and the birth of a child, and while this episode will focus more on the time after the baby is born, we do talk about pregnancy as well. Having 4 children myself, issues surrounding motherhood are close to my heart. I became pregnant only about 9 months after I stopped binging, and I remember being so grateful that I didn't have to deal with the eating disorder on top of everything else that went on through my pregnancy and when my children were born. But if circumstances would have been different, this may not have been the case. And I've talked to so many women who have had to navigate this difficult time while also struggling with binge eating and other problematic eating behaviors. And even for people who are recovered, like I was, there are still challenges with body image and things like appetite changes, difficulty managing the stress, and extreme schedule changes that come along with having a child, which are all things that we'll discuss in today's show. My guest for this episode is Nicole Longmire, and she does wonderful work supporting and educating moms in pregnancy, in the postpartum period, and during breastfeeding as well. And she'll tell you all about herself in our conversation. I feel very fortunate that Nicole came into my life about 6 years ago when she became my cousin by marriage. She's such an inspiring woman, both personally and professionally, and such a great mom as well. As I learned more about her work, I knew that she could provide an extremely helpful perspective to all of you listening, and I invited her to be on the show. Before we get started, I want to say that even if you don't think the topic of postpartum and breastfeeding applies to you directly, there are so many lessons to be learned from this particular stage of life that could also apply to other challenging stages of life as well. As you listen, you can think about times in your life that may not be related to caring for a baby, but that demands were placed on you physically, mentally, and emotionally. I always say that you can learn to be binge-free no matter what is going on in your life. But as you recover, you may find that certain times and circumstances require more effort and awareness, and possibly some help and support to continue your commitment to avoid dieting and avoid binge eating. While Nicole is not and does not claim to be an expert in the area of eating or eating disorders, her wisdom and guidance surrounding pregnancy, the postpartum period, and breastfeeding will help you navigate this often very difficult but also exciting time without reigniting any unhealthy habits. Welcome to the show, Nicole.
Thank you so much. Happy to be here.
Yeah, so can you start by just telling everyone who you are and what you do?
Absolutely. So I am an international board certified lactation consultant, an IBCLC for short. It's kind of a mouthful. And I also am trained in maternal mental health. I'm a childbirth educator. So I kind of do everything from pregnancy through postpartum, but I don't do birth. I do all the before and all the after.
Yeah. And I'm so happy to have you here and talk to you because there's so many issues that come up for people that I work with surrounding pregnancy, childbirth, postpartum period, and breastfeeding. So I was really happy to just have you go through some of those issues and offer your words of wisdom and support to all my listeners. And I want to start with just the idea and the fact that women just don't get the support often that they need after birth and during that postpartum period. And you had a great conversation on your podcast recently about sort of the evolutionary history of this and of motherhood and how until recently mothers had a lot of support, but now women are mostly isolated. So how do you see this affecting the mental health of new moms?
Yeah, well, you said the buzzword isolated. I think we're just so separated from everything, And the real reality of this is that as humans, we're social creatures. We're like apes, we're supposed to be in groups and in tribes. We were never meant to mother alone. And I think that most of the issues that we see are due to that isolation. Things like postpartum depression, disordered eating, which I know we're going to get to, problems in relationships, problems bonding with our babies, dealing with birth trauma, feeding our babies, all of these different things that we hear these stories of how they go terribly wrong for so many people. I think ultimately just comes back to that isolation and the fact that we're so separated. We don't grow up seeing these behaviors. We don't grow up seeing breastfeeding, for example. A lot of us did not grow up, seeing people around us breastfeeding and as social creatures, unless we see it or if they're not modeled correctly, then we're not going to have those skills. So yeah, I think it really comes down to that separation.
Yeah, it's a hard and confusing time. Even if everything goes well with the birth and the baby, it's so confusing. You often don't know what to do. And I was recovered for a while by the time I had my first child, but I remember thinking, gosh, if I was struggling with eating issues right now, this would be so much harder.
Yeah, it's definitely a time where all of those past demons are going to come up, and it's actually kind of interesting because even if we don't have, something diagnosable in our history, we all have hard stuff. And some of us have, childhood trauma, or maybe we have relationship trauma, or we have, some sort of like mother wound, something from our own mother, or of course a diagnosable mental health condition. And those things are going to come up because it is such a hard time, like you said, even if everything is going right.
Yeah, for sure. And a lot of times things don't go right. Health issues of the mother after birth, health issues of the baby. I know you have your own story of very traumatic and devastating experience after childbirth.
Yeah, I have. Actually, I've had 2 births and neither of them went the way that I envisioned, and neither of them had the end result that I envisioned. I'll speak briefly to my first. It ended in a C-section. I ended up having some complications. And so that postpartum time that was supposed to be this, sort of like beautiful, blissful recovery, was in and out of the hospital, trying to figure out what was going on. I had a bad infection. And so really struggling with that impacted my mental health quite a bit. And then my second birth, which was just a little over 2 years ago, was very different, but very traumatic kind of in its own way. It was kind of at the tail end of COVID. And so, for anyone listening, if you've had a COVID baby, a lot of us went through, challenges with those pregnancies and those deliveries, whether it was that your, doctor wasn't able to be there or your partner wasn't allowed in, or you had to wear a mask during your delivery. And so I experienced my second birth pretty much alone, which was pretty awful. And then our son actually was born with some very serious heart defects, and we actually lost him when he was 5 weeks old. So talk about mental health. I mean, it's again, just like you said, even when everything goes great, it's a hard time anyway. Your hormones, truly are crazy. It's the biggest hormonal shift and crash that a human being experiences. And then if you throw in birth trauma and, health issues, and then for us, it was, the loss of our baby, it's a lot to overcome.
Yeah. For sure. And I think your story just makes what you talk about so powerful because you've been there. You've been through the worst of the postpartum period. And just the fact that you're out there supporting other people is amazing. So I appreciate everything you shared there. How do you go about supporting people with the emotional issues that come up? What are some, maybe resources or tools people could use during this time?
Well, I mean, I think always the best plan of action is prevention. So anything that we can do to help try to prevent things from getting to kind of a crisis place when it comes to mental health. And I come from a public health background, so I'm very big in prevention. I'd rather prevent than treat. And so I think one of the most important things, if I'm working with a client, is to understand their history. If I'm working with you prenatally, that's even better because I can understand, you can explain to me kind of like what's going on, what you've been through, what maybe some of your traumas are. Or are you coming to this pregnancy with, disordered eating or a mental health condition? Do you have a history of traumatic birth? Do you have a history of maybe a traumatic breastfeeding experience? I have a lot of moms who come to me for feeding help that have had difficult experiences in the past. And they're very nervous. They're very nervous because they don't want to feel that way again. They don't want to feel like a failure again. So that's really important. And I think for anyone listening, if you're pregnant or, want to become pregnant or trying to become pregnant, be prepared to find people that are going to be part of your team. That's not just your OB. I think for a long time the thought was you get pregnant and then you just go see your doctor and like everything you need will be there. Everything you need will be at your doctor's office. Everything you need will be at the hospital. And unfortunately, we know that that's not the case. We know that women have more needs than our, maternal health system is providing for us. And so seek out your lactation consultants, your childbirth educators, your birth trauma specialists, your mental health professionals, your dietitians, your, nutritionists, whoever it is, so that you can really talk through some of that past stuff that you're bringing in to the pregnancy. So that's kind of one thing, right? Really sort of like uncovering that and digging that up without it being therapy, right? Because I'm not a licensed therapist, but I feel like I do quite a bit of counseling in my work. And then the other, of course, piece to this is if we have problems, right? Whatever those may be. It's really important for me as a provider to view that person holistically. And I think this is another area where our medical model really lets us down as women because you might go to your OB or then to your primary care, once you're dismissed from the OB, you go back to primary care and you're in and you're out. They don't usually have a whole lot of time to spend with you. They might be able to direct you to a few resources, but it's not able, the way that system is set up, to really be as holistic, as it needs to be. And I don't mean holistic as in woo-woo, right? I mean holistic as this is a whole person. And this is a whole person who maybe is having a breastfeeding issue, but that breastfeeding issue has to be viewed in the context of her history with disordered eating, her relationship status, her social economical status, whatever these other factors are that are going to be impacting this person in this moment have to be taken into consideration so that we can develop plans, to help get somebody through those hurdles.
Yeah, I really like all of that. I mean, I like your idea of prevention because when you have a baby and the aftermath of that, is lack of sleep, it's stress, it's confusion, it's like we talked about the isolation. And when you're in that state, the default of your brain is to go back toward things that maybe were habitual for you and things that just are not the ways to get through this. So I think setting yourself up to be able to get the support you need to really talk through these things so that you don't find yourself defaulting to those old habitual destructive behaviors.
Yeah. And having expectations that are realistic and reasonable about what this is going to be like, especially if you're a first-time mom. I talk to moms all the time, right? And they'll tell me, I knew I would be tired, but I had no idea I'd be this tired, or I knew it would be hard, but I had no idea it would be hard like this.
Yeah.
And this, they can't even really explain it because it's kind of unexplainable, right? Unless you've really been through it. And everybody wants to blame the hormones, but there is evidence, that supports that. We know it's the biggest crash. We know that the interplay, in pregnancy between mom and baby is one hormonal kind of thing. And now baby's out and the placenta's out and it's not excreting all these hormones, right? And so we suddenly have this disturbance in mom's whole system. And so that's a very real thing that's happening. And then you add on the exhaustion. You add on the unknowns, right? Things like, is the baby going to sleep tonight? How long will this nap last? Will this feeding hurt? The last one didn't, but I don't know if this one's going to, a lot of times it's just that unknown. And then sort of the never ending cycle, I think, of postpartum. And I might be jumping ahead, but if you are the type of person who very much likes routine and schedule, maybe, that controlling, and we all love to be in control to a certain extent, right? But I can imagine that someone that might be prone to, having an eating disorder, and I don't know, because this is not my area of expertise, so please correct me if I'm wrong, but I would assume there's an element of control to that plays out and manifests differently for different people. But if you are a person that needs to sort of have everything controlled and in place and in order, and you like putting kind of the period at the end of the sentence and turn off we are done, postpartum's not like that. I mean, it just, there's no time, there's no concept of day and night. Everything's just sort of morphing together. And so you don't have, especially if you're a highly productive person, you sort of don't have those opportunities to have that control back. So I tell clients prenatally, like, prepare for those visceral, like, intense feelings and know that they don't make you a bad mom when you're feeling them. It's a physiological thing that's happening that's making you feel that thing so intensely. And your brain is going to go into that fight or flight. And if your coping mechanism has been, right, to overeat, undereat, whatever it is, that is where you're going to default. Absolutely.
Yeah, that's really interesting. And it's funny, like, we're talking here about the postpartum period, like, it's so hard. And I think the culture gives us the expectation that it's going to be this beautiful time and amazing, and you're going to bond with your baby. And, we're here saying, like, that's not always the case, and that's okay. So I love what you talked about with the expectations. I also loved what you talked about as far as the control, because a lot of people who do struggle with eating like to have their routine surrounding food, like to have meals at certain times and know what they're eating. And I remember just grabbing whatever kind of snack I could because I was starving, because I was breastfeeding and using a lot of calories, which we're going to get to as well. But there's no time. I'm taking care of other babies. And it was just, I wrote in my book, actually, that this time, like, if my recovery wasn't so solid, then it would have been a risky time, I think, because my eating was very different than it was before I had the baby. Yeah, so let's get into talking more about the food, because like I talked about being hungry breastfeeding, there is an actual need for increased calories. Your body is using more energy to produce breast milk if you are breastfeeding, and even postpartum, just to recover and heal. So can you talk about that as far as, like, what are the increased calorie needs, just so that people can understand that having an increased appetite is not an abnormal thing. It doesn't mean there's something wrong with you. It doesn't mean you're going back down the path of disordered eating.
Yeah, absolutely. It's such a great question. I find that it's pretty variable. And what I mean by that is I will have clients who come in that say, oh my gosh, yeah, I'm just ravenous. I'm eating everything. I'm eating more than I was in pregnancy. And they're either okay with that, or maybe it's making them a little bit uncomfortable. And then I will also have clients who have no appetite. And so I think one of the things that's important to understand is that, yes, the body needs the fuel. You are trying to heal regardless of what kind of birth you had. You have lost blood. Your body is sending all its, all its little soldiers, right, to help repair that dinner plate size wound in your uterus left from the placenta. We're really trying, to help the body out. And so that's just to recover from the birth. And then, of course, in lactation, we know that moms do need more calories. The research, is a little bit gray. It is dependent on the person. So that's the first thing to know. It is dependent on the person. We don't want to just say, you must eat 500 more calories a day if you're going to breastfeed. And I can actually see where that would be sort of a deterrent for someone who has a history, with eating and with food to maybe not want to breastfeed. Oh, I don't want to eat 500 more calories a day. I can't wait to not be pregnant so I don't have to eat for two.
That's a really good point.
Yeah. And so it's highly dependent on the person. I'm glad this came up because there's actually something really interesting that I had come across recently that was talking about sort of that eating for two. And I mean, I remember saying that, when I was pregnant the first time, like, oh, I'm going to have an extra piece of pie because I'm eating for two. And that's really not healthy, right? And that's really not the way we should be thinking about it. An actually more accurate way to talk about it is metabolizing for two. And so what that actually means is that when we think of like the body's metabolism, the end or kind of the reset time is not the delivery. It's not the birth. It actually is supposed to, right, from an evolutionary standpoint as mammals, to end with weaning. And they actually have named this the reset hypothesis, which, just I totally geeked out about when I was reading about it. But the idea of this is if during the pregnancy, we know that our body is going to put on extra fat, right? And that is one of the hard things about pregnancy, especially for somebody who may have some issues with, body image and things like that. We are going to accumulate more fat. We are going to have more insulin resistance, our lipid levels increase, and all of these things are designed, right? They're packing on to help support the pregnancy, help support mom right through the birth, but really to help support the process of lactation. And what we've seen in studies is that women who breastfeed, yes, most of them are going to need more calories in the beginning, but after about that 3-ish month mark, they actually will lose more of that fat, right? From like the buttocks and the thighs, that fat that really kind of packed on during the pregnancy, because the body is mobilizing that fat to build baby's brain, right? So essentially your butt gets big so that your baby can have a big brain when you breastfeed them.
That's a great way to think about it. And as we're talking about, weight gain during pregnancy, which is a very normal thing, and it can be a difficult thing for people, like you said, who struggle with body image. And there's also cultural pressure around that. I think there's so many cultural messages that we send to women, like as soon as you have that baby, you better be getting your body back. You better be looking exactly like you did before you got pregnant. And it can add another layer of stress, another layer of self-consciousness about how you look. So how do you encourage people to resist these messages of diet culture?
Oh my gosh, it's so hard. It's so ingrained, as whether it's from media representation, cultural expectations, obviously lots and lots of historical influence. And now with social media, I don't know if it's better or worse. We have a lot of like body positive things and sort of a movement towards embracing our bodies, regardless of, the number on a scale, really embracing like health instead of size. But I still see it all the time. Moms who are they'll say they understand that the body has gone through all of this and that they're not supposed to just bounce back, but they want to, they want that 6-week appointment so they can get cleared to work out. And so I think, unfortunately, the best way is if we can educate women ahead of time, of what those expectations are going to be, why your body changes in the way that it does. For me, if I understand why something is, it doesn't necessarily make it easier, but it helps make it make sense. And I'm less likely to resist it. So when I'm talking to new parents, for example, about how newborns, want to be on you all the time, and that's not a problem, and that's natural, and we're carry mammals, the light bulb sometimes will go off, which is great because they realize, oh, okay, so what we've been experiencing is actually normal and healthy. It doesn't make it easier necessarily, right, to not be able to put that baby down and have it sleep for 8 hours, but it makes more sense. And so when we understand that it has a biological function that can help kind of soften it, I think, a little bit. And then again, on the prevention side, if you know that that's going to be something that you really, really are going to struggle with, that's a risk factor for you to potentially, not having a healthy pregnancy, then getting that support up front, whether that's from your therapist or your nutritionist, your dietitian, whoever is on your team, whoever you're working with, to kind of keep that in check so that you can have that healthy pregnancy and that you can have a healthy baby.
Yeah, for sure. Because if you're so worried about your body that you're not giving yourself enough food, that becomes a huge risk. And that's a big part of what I teach as far as ending binge eating. You have to be eating enough. You can't be restricting. It's so important. And when you're worried about another life as well, it just becomes all the more important. I want to talk a little bit along that same topic. Sometimes people can maybe not restrict their calories and undereat, but really try to be too perfect in what they're eating, as far as like they're worried about everything needing to be clean and everything needing to be just perfect for what they're putting in their body to nourish the baby. And while this is a great intention, I don't think it has to be a bad thing. People, again, in my realm of work, tend to struggle with food obsessions, and they can get obsessed with this and eating clean and almost tip into disordered behavior surrounding this. So how do you teach people as far as nourishing their body without letting it become an obsession?
That's definitely a tricky area. And, my background is not specifically nutrition. So if I had somebody that, had shared that with me, I would absolutely recommend, obviously, that they, be partnering with professionals who that is their area of expertise. Mm-hmm. But, I think as a general sort of kind of like tips, I would really try to talk to them about focus on nutrient-rich foods. So whether maybe your thing is clean, right? Like you said, or it has to be organic, or it has to be, something very, very specific, that can lead to somebody not eating a balanced and varied diet, right? Mm-hmm. And so we want to make sure that we're getting as much variety as possible and that we're focusing on as nutrient-rich, dense, of foods that we possibly can. I think one thing that gets said a lot is this whole like, listen to your body. And I think that that's flawed in so many ways. I think the intent of that is great, but for most of us, we did not grow up being told that we could listen to our bodies, look at our bodies, understand our bodies. I think the young ladies, of today, I'm dating myself a little bit, but the new generation, I think it's going to be a little bit more empowered, but I think we were still kind of coming off of the generation where, we don't talk about bodies and we don't talk about what bodies, do or what they need. And so we don't really know our bodies very well. And so listening to your body can be problematic, whether that's in pregnancy, in birth, in breastfeeding, and in eating. But that being said, it is important, that we're paying attention to those hunger and fullness cues as you're learning those things about your baby, thinking about ways that you and your baby are learning together. And so we're both honoring our bodies. I'm going to nourish you, and every time I nourish you, I'm going to nourish my own body, whether that's, a snack, a protein shake, whatever. So really just trying to encourage them to tap into that, wisdom as best they can, without being too cliche, like just listen to your body. Because I just don't think that's super helpful.
I like all that. It's that intention to nourish yourself without it needing to be absolutely perfect in every moment, and trusting that your body can do what it needs to do as long as you, again, have that intention to nourish yourself. I want to ask you one question. So what part of my experience with breastfeeding was my babies had these really bad gastrointestinal symptoms. Like one of them had intestinal bleeding and the doctors told me, okay, like it's what you're eating. So I had to cut out so many things from my diet. And my recovery, again, was very solid at that time. And it really wasn't that big of a deal. I mean, I didn't like it. It wasn't easy, but I was able to still get enough calories. This wasn't really triggering for me. But I can see how someone who is struggling with disordered eating and the doctor says, okay, or anyone who gives them advice about breastfeeding, oh, your baby's stomach hurts, cut out dairy, cut out meat, cut out wheat. There's so much different advice out there about what you should not be eating. And again, this can be a slippery slope to malnourishment. So do you feel like there's an overabundance of, I guess, advice to cut out foods? And is there a true need for it in some situations?
Yes, you have asked the $1,000,000 question. There is such a pervasive push to have women eliminate foods from their diet. And I can tell you that as a lactation consultant, that would be the absolute last resort that I would ever recommend to a mom who is breastfeeding, who's having any challenges at all. And the reason why is primarily exactly what you just said. It can exacerbate eating issues, food issues. There's a limited number of things that she may currently even have an appetite for, right? Depending on her resources, it just may not be feasible. I worked for WIC for a year, and there's only certain foods, right, that they can get through WIC. And good Lord, they get so much milk. That's a whole nother topic. But if that mom now has to cut out dairy, well, she can't transfer those WIC dollars to something else. Luckily WIC has kind of come a little bit into the 21st century, and they have some plant-based milks and things like that now. But eliminating foods can exacerbate mental health problems. It just can be very, very difficult. And what usually ends up happening is the elimination diet doesn't actually work because, to speak to your first question, it wasn't needed in the first place. And so I think there's a lot of misinformation out there about elimination diets. A lot of the symptoms can look like an allergy when really it's what I would consider a functional issue. And that's where it's the lactation consultant that is the specialist in functional feeding, and the doctor is the specialist in medicine. So whenever we have a baby that is having GI issues, severe reflux, not gaining enough weight, there are so many things that I hear pediatricians recommend. Let's add a little bit of formula to your breast milk. Let's have you stop breastfeeding for 2 weeks and try this special hypoallergenic formula. Let's have you eliminate this, and this, And the reality is a lot of those things cause just more problems. And so without giving you a lactation lesson, there is usually, like I said, a functional issue with how that baby is getting that milk out that is causing either extra air, excess sugary or watery milk, kind of not mixing because of mom has a fast flow. There's lots of reasons. There's lots of things. It's very frustrating for families when they've gone on these elimination diets. And a lot of things end up kind of being a little bit of a placebo, I think. And I will have moms come to me and say, well, I cut this out and I feel like it helped for a couple of days and now it's not helping anymore. I said, well, then it wasn't that, because if it truly was that, then getting it out of your system, which doesn't take that long, there's also that misconception, will do the trick. And if it's really not doing the trick, then there is something else going on. So anybody who's listening, who's having a baby, has a baby, you've got feeding issues, please see your lactation consultant, because it's, especially if you've been told to cut out foods, because it is 95% certainty that that's not even something that you need to do.
Yeah. And it's something that if you're in recovery or you're working on recovery, it could cause risk to your recovery from an eating disorder, as far as just having to slash out all these food groups. There was a time I was eating like chicken and rice, and that was it. And, maybe it was helping, maybe it wasn't, but I don't know. That's just what I was told to do because of all the symptoms. And I really wanted to continue breastfeeding. There was always the option of formula, but it was something that in my heart I wanted to do. And I felt like it was the right thing for me at the time. So yeah, I really appreciate all that. And I wish someone would have told me that when I was eating chicken and rice. I teach people to eat in the least restrictive way that's possible for them. Now, of course, sometimes there's true allergies in the mother. And of course, sometimes certain foods don't work for certain people. But if you're eliminating foods for breastfeeding reasons and for the baby, I love your, suggestion to see a lactation consultant.
Let's rule out other things.
Yeah.
And I will add just really quickly, there are, some cases of allergy, absolutely true allergy, but there's different types of allergies. So my first, as you know, has severe dairy milk protein allergy, like has an EpiPen. And he breastfed for 2 years and I never cut out dairy because his type of allergy interacts on the immune system. And so he can't have dairy directly, but there's such a tiny amount that actually is transferring in the milk that it didn't give him symptoms through breastfeeding. And so a lot of times the GI type stuff is more about, maybe just like a disturbed gut issue. Maybe some probiotics could be helpful for mom, sometimes even probiotics for baby, because we've got a little bit of like gut imbalance going on rather than allergy.
Yeah.
Right. It's just an important distinction, I think, for people to make, because a lot of things get lumped in. And we even have moms saying now, you open TikTok and they're like, my baby was allergic to my breast milk, which is not a thing. There's never been a case of a baby allergic to breast milk. The only situation where we would have a baby who can't have breast milk, they'd be very, very sickly, and they also wouldn't be able to have formula. So, there's just a lot of misinformation about it.
So we've talked a lot about the challenges that come up in this postpartum period and breastfeeding and how it can be difficult. But I think it also can be an opportunity. Like your body's doing this amazing thing. Like it's growing a child, you're birthing a child, you're feeding a child from your own body. And it's really amazing. And people who do struggle with body image issues, I think this can also be an opportunity to reconnect with your body, to appreciate it, to really be in awe of it. So, how can this be an opportunity for people rather than something that has to always feel so hard?
Yeah. Well, there's always people who love pregnancy and people who don't do so well with pregnancy. I'm a person that loves pregnancy. So I would be pregnant 10 more times, if I could. I don't want to raise 10 more humans, but I think pregnancy is wonderful and I just love it. I think it's great. But I think, regardless of kind of what mindset you're coming to it with, it is amazing. I mean, what is more amazing than actually growing a human being? Other than then you make food for the human being, which of course I think is like the coolest component to all of it. But, surrounding yourself with people who are like-minded, you're going to attract what you put out, right? And so seek out people that are talking positively about their experience, even if maybe you're not feeling super positive, because that can be a bit contagious. It's just kind of like that body positivity, right? Like unfollow the accounts on social media that are making you feel bad about yourself and start following people who are talking about things that you are drawn to, or that maybe you aspire, to think like that. Social media can be a complete dumpster fire, or it can be a really great place, to connect with other people who are like-minded. So, I think it's an opportunity to find your tribe. We are so isolated, but find a tribe of people who are having positive experiences and are talking about how they're connecting with their body and their baby and things like that. Of course, mental health support, again, if you're finding that it's difficult to really get in touch like that, then maybe it's something, you want to talk out with a therapist or a trusted friend, somebody who's, got a counseling background to talk about some of that stuff. I think that there's a lot of opportunity also for ritual, and in our culture, we don't have a lot of that. In our kind of like westernized modern American culture, we don't have a lot of ritual. And the ones that we do have are very baby focused. They're not very mom focused. So I love things like, instead of a baby shower, have a nesting party where you have other women come over and you cook together and you prepare postpartum meals. You tidy up the house, you sort of get your breastfeeding station, set up, you make a belly cast, make a flower crown, I don't know, all the things that make you feel beautiful, because you can buy onesies and you can get diapers and you can do all of that stuff, but really celebrating yourself and having some sort of like ritual experiences during your pregnancy, I think can really go a long way to making you feel important, because you are the main character. You are the life force. You are everything. And so, we need that main character energy from you.
That's awesome. I love all of that. I mean, just to take those proactive steps to build yourself up, to seek out people who are sharing a message that makes you feel good about yourself, not makes you feel like you have to get your body back 6 weeks after pregnancy.
Exactly.
Find the people that are sharing positive messages about pregnancy and birth and breastfeeding. And you are definitely one of those people. So how can people find you on social media and get your lactation services?
Yeah, absolutely. I love being one of those people and again, want to support women and families through all of this complicated but beautiful time in their lives. So the best way to reach me, I have a website. It's Mother Nurture Lactation Services. Again, it's a bit of a mouthful. Mother Nurture lactationservices.com. I'm very active on Instagram. My handle is Mothering Nurtured. I am on Facebook as well. People can find me by the same name, Mother Nurture. And that's actually the name of my company. So yeah, postpartum support. I do doula in-home doula support for postpartum. I do childbirth education, of course, the lactation support and some mental health supports as well.
Great. And I'll include links to all of your website and social media in the show description. And thank you so much, Nicole, for being here today.
Thank you so much for having me. It was a pleasure.
I hope you learned a lot from listening to Nicole and that you'll check out the links in the show description to connect with her. You can also find all of the Brain Over Binge resources in the show description, including my books, online course, and one-on-one coaching and group coaching. Thank you so much for being here today. I hope you'll subscribe to the podcast for more help with overcoming binge eating and related issues. Regardless of the stage of life that you're in right now, I want to encourage you and remind you that you have the power to change your brain and live a binge-free life. The Brain Over Binge podcast is produced and recorded by Brain Over Binge Recovery Coaching, LLC. All work is copyrighted by Brain Over Binge Recovery Coaching, LLC, and all rights are reserved. As a disclaimer, the hosts of the Brain Over Binge podcast are not professional counselors or licensed healthcare providers, and this podcast is not a substitute for medical advice or any form of professional therapy. Eating disorders can have serious health consequences, and you are strongly advised to seek medical attention for matters relating to your health. Please get help when you need it, and good luck on your journey. Need more help? You can find all of our current and upcoming options for support at brainoverbinge.com.